the connection of the sphenoid bone, what connects these bones in the face? What is the connection?
Okay. So we're going in here, right?
Yep. And for those at home, we're holding up a skull.
Yeah,
when
we're
we're different colored plates on the face.
Okay, so we're gonna go directly into the sinus nasal cavity. Okay.
Mm-hmm.
There's gonna be an upper, a middle, and a lower chamber that we can go into. Okay, each side. So 3 in each side. Okay. I'm gonna test where to go by placing my fingers on very specific fascial points through that sphenoid. So this red right here is the sphenoid bone. So I'm going to be pushing lower, middle, and superior sphenoid to figure out where am I going to put that balloon through this way. Okay.
Mm-hmm.
Simply put. Now, if you notice just from the side here, look at all the bones connecting the sphenoid, right? Maxilla, zygomatic, temporal, parietal, frontal. They're all touching sphenoid, right? So then if we open this guy up, this is where it gets really wild. So most people haven't seen like the bottom of the inside of their skull, right? And
Yeah.
not either. But so look at here. This is all sphenoid. Okay, you got pineal and cribriform plate right here. Okay, so what we're trying to do is push the cerebral spinal fluid up through that spinal ventricle, like the actual ventricles within the brain, to get that fluid flowing to start flushing a lot of the toxins from a neural brain standpoint. Okay.
Mm-hmm.
That's one thing. But actually changing the position of the sphenoid here is going to affect all the bones attached to it. Okay. And this plate right here, this is where that fascia I was talking about anchors itself. Okay, so that meningeal dura fascia anchors itself right in the front here, and you can see how close that is to that actual nasal bone here. And then it wraps around the brain and it comes right down to the spinal cord.
Wow.
Okay, so that makes total sense, doesn't it? Like if we were going to release tension in the body from a most fundamental way, most center point of the body, it's going to be right here because that's where it's anchored. That's where it starts, wraps around the brain, goes down the spinal cord, connects to the rest of the body, right? So this is where that air passes through your nose and then rubs right across this plate here to basically hyperionize the oxygen, right, in the cerebral spinal fluid. So it's very fascinating, this bone. This is like I said, it's a very ancient, very fascinating bone. To me, this is like the keystone of like consciousness.
Amazing. And what have you, I'm assuming the endonasal procedure or a functional cranial release, it over time, does it hold some of the malleability or the change?
Yeah, absolutely. So like that's the thing. Like I usually tell people to do a series of this because again, we're going to be switching positions. It's going to move around. So it's pretty close to permanent once you get through that first series. Okay, we're going to break up a majority of the fascial restrictions in that bone just through the first series. Now, if it's somebody who's had something pretty traumatic or for a long time, we would take a break for like a month or two, and then we would do another series to get to the next layer because your body still has to assimilate the change, right? So I still want you to go run and breathe through your nose and, live life because your body's it takes time to like readjust to this stuff. It's not, in the beginning, it's going to move a lot and you got to be prepared for that. Especially if you're somebody who's had significant trauma to the face, expect a significant result and significant, I say, experience, because I don't.
Recalibration.
Yeah, recalibration. You may want to take a day out. May want to do it on a Saturday or something. Because
Right.
I remember after my first one, I was brain foggy. I didn't really want to have conversations, and I was down at a biohacking mastermind. I think Thaddeus, Primal Hacker.
Yeah.
And we were down at that mastermind, and I couldn't talk to anybody. I'm like, I literally just have to go to sleep, and I had a little headache too. So just just know there's a reaction.
Yeah. I would assume so. Man, it's so wild. And is it, I assume you said you were doing these and then you went through another training and it changed the way that you were doing the procedure. Who do people look for? Is there like a credential or a certification that they went through?
Yes, and I'm not familiar with all the certifications. I think there's a few different versions out there. I was originally trained through ABC to do the balloons. Okay.
Mm-hmm.
And that was really basic training. It was just like put the balloon in on this place and pump it up and take it out. And that was about it. And that's pretty much the majority of what it is with all the techniques. That's pretty much what it is. The discrepancy of the technique that you'll find is, should you do all the chambers all at once every visit? Or should you be very specific on which chamber you're doing on each side
Mm-hmm.
and then letting the body assimilate that way? Or, should you do one treatment? Should you do 10? Should it be 5,000? Should it be $200? There's a lot of discrepancy in that. And that's probably why it's not such a super well-known thing right now. I mean, it's blowing up on YouTube.
It is blowing up. I see more and more people, more and more professional athletes, more Olympic athletes are starting to do this.
Yeah.